Pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now a reading of the mission statement. Megan, would you read?
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Megan. And before we adopt the agenda, Dave, would you please say something about Mr. Dana Geyer?
Yeah, I was notified by Helen Klinger, who's our Director of Substance Use. I was notified by Helen Klinger, who's our Director of Substance Use Services, about the passing of Dana Geyer. Dana was the Substance Use Prevention Coordinator for over 35 years and made many important contributions in Macomb County and at the state level. He was well respected and liked statewide, having served on many work groups and committees. I also talked to Helen today, and I learned even more. It was quite the impressive work history. He retired from MCOSA, which is the Macomb County Office of Substance Abuse, in 2010, but stayed involved in the substance use work here in Macomb County for many years, and he served on the Oversight Policy Board as well. He was a very positive person, always willing to help others and great to work with. From Helen, we will miss you, Dana, and his obituary is listed at dignitymemorial.com. So, thank you.
Thank you, Dave. That's sad news. Number 3, adoption of the agenda. Is there a motion to adopt the agenda?
Support.
Motion by Megan, support by Selena. All in favor signify by saying aye. Aye. Motion carries. Number 5A, request to approve residential lease A.
I hope you skipped hearing of the public.
I did? Oh, thank you. Item number 4, hearing of the public. Is there anyone from the public looking to speak to this board? And there's another hearing of the public at the end of the meeting. Going once, going twice? Okay. Number 5, request to approve, 5A, request to approve residential lease A.
So moved.
Support.
Motion by Megan, support by Antoinette. Any discussion? Tracy and TJ? Just TJ today, no Tracy. You have anything to add? Any questions? Okay. Does anyone have any questions? All right, to move to full board, all in favor signify by saying aye.
Aye.
Motion carries. Item 5B, request to approve PIHP contract amendment 5, requesting final approval today for signature, and this has been approved by legal. Is there a motion?
So moved.
Motion by Antoinette and support by Selena. Dave?
Thank you. Due to the timing of this, we are requesting the approval to allow the Office of the County Executive and myself to sign this amendment. The details are in the packet. There is a change of $134 million, a little more than that, to our PIHP contract. They've also amended some of the contract language, which starts on page 3. I have distributed this to the leadership team. There's a number of changes to the grievance and appeals, which is the largest area. There's also things about network capacity, and we did receive a request from the state as well to give them detailed information about our current provider network system. So it is an area of focus at the state level. So like I said, we're following up to make sure that all of these changes, that we're aware of them and tracking them internally appropriately. And with your approval, I will, again, this is an electronic signature process back through the state of Michigan. Thank you.
Thank you, Dave. Any questions for Dave? All right, all in favor signify by saying aye. Aye. All opposed? Motion carries. Item 5C, request to approve Molina rate amendment for 2022, and this also has been approved by Legal and Finance.
So moved.
Motion by Megan,
Support.
support by Linda, and Ken. Hi.
Yes. Hello, everyone. Just a couple quick comments on this so that for clarity, this is something that happens every year with Molina. They're one of our ICOs for the My Health Link program. The rate is substantially the same as last year. We revise rates every year based on the actual claims, so it's pretty consistent from year to year, but just getting approval for calendar 22 at this point. Thank you.
Any questions for Ken? Phil, do you have a question? No? All in favor signify by saying aye. Aye. Motion carries. Item 5D, request to approve National Council for Mental Well-Being Agreement to provide consulting services to Case to Care trainings, and this has been approved by legal.
So moved.
Support.
Motion by Megan, support by Selena.
At
This
this
is
point, I
Agnes.
was wishing I had some really important things in the packet that I could get approved really soon. Dr. Agnes Ward is here to speak about the case to care management.
Good evening. So this is a training for our staff, for our case managers, and for our therapists. Case to care is important because we are an integrated care facility, and what this training provides, an integrated care organization, and what this training provides is a focus not only on behavioral health, but also on medical health. So it focuses on staff being able to write appropriate goals, really look at and address medical care along with behavioral health concerns, and really write those integrated goals and care plans. And that is really the direction that we want to be headed. This is just a crucial training for care management and providing a higher quality of care.
Thank you.
Thank you.
Is there any questions? All right, thank you. All in favor signify by saying aye. Aye. All opposed? Motion passes. Item 5E, request to approve Lakeview Consultants LLC CCBHC Evaluation and Program Development Proposal. Is there a motion?
So moved. Support.
Motion by Donna, support by Selena. All right, and this is for Dave.
Good evening. Sarah Bannon, who's the consultant through Lakeview, was actually very helpful to us in writing our CCBHC expansion grant, which we were awarded for the $3.4 million for 2 years, which ended April of this year. She offered an interesting opportunity for us. She's worked with a number of other CCBHC sites nationally and statewide here, kind of a check-in to let us know. And one of the interesting things especially with the expansion grants, was everybody wrote those proposals a little bit differently. So we've said if you've seen one expansion grant site, you've seen one. She has seen more than one. So I talked to Ann, who's our program director for our program, to see if she'd be interested in this type of opportunity to kind of compare and contrast, give us some really good feedback about how we're doing with our CCBHC program. Again, the expansion grant ended April. We're currently in the demonstration project as of October, so it's a kind of a good time to check in, make sure things are going the right way. So we had this opportunity. We do think it'll be very helpful going forward, and I appreciate your approval.
Okay, any questions for Dave? No questions? All in favor signify by saying aye. 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 Motion carries. Item 5F, request to approve Medversant Addendum Enrollment Services, and this has been approved by legal. Is there a motion?
Support.
Motion by Antoinette, support by Linda. Let her rip, Ken.
Good evening again. This amendment is to the existing Medversant contract that we have. MedVerson is helping currently with credentialing and privileging services. The amendment that we're proposing is so that they can further expand their services and help us with enrollment. So are enrolling our direct run staff with third-party insurances, but also as the DCOs come on board as part of CCBHC, want to make sure that we have capacity to handle doing all the credentialing, privileging, and enrollment for them as well. So just for some perspective, we have, I would say, roughly 85 direct staff right now. Projecting at the start of bringing on the DCOs that we would have about 200 people that we need to credential, enroll. It's quite a heavy lift. So bringing on this company to help, I think, makes a ton of sense. It's our peers are using them. Oakland, Wayne, they're a national company. They're good at what they do. It also allows us, in the long term, there are some upfront costs, but over the long term, it will be a cost savings, in our opinion, against having 2 to 3 FTEs that would be dedicated strictly to doing this type of work. The ancillary benefits are an enhanced technology platform. They're doing monitoring for us, background checks, all these different things that are really going to help us out and be efficient. In addition to some of the cost, we will have an offset of the cost with our efficiencies with billing. We're going to be able to bill more. We're going to have less rejections. So that number's hard to quantify, but ultimately we're going to see an increase in revenue, particularly with more mild to moderate individuals coming on board with CCBHC. So I'll take any questions about that if there are any.
Phil?
Somebody's got to say something. So, been sitting here for too long today. I honestly don't have any questions. I just want to thank Ken and Stacy for sitting down with most of us yesterday and walking us through this. I was a little iffy at first because the dollar amount is substantial, but going through it and seeing what we would gain as a CMH, as a department, as a CCBHC, it just seemed the right way to go. So I'm supportive of it, and I want to thank you both for walking me through it and us through it to see the value. So thank you, Ken. Thank you, Mr.
Absolutely.
Chair. Anyone else? I'd like to just echo what Phil had to say. Thank you, Ken. Thank you, Stacy. The other piece was about the credentialing. I thought was really impressive too, just by delegating it to this group that, we check the box and we don't have to worry about things falling through the cracks. I mean, everyone makes human errors. That we'll be safer. So all in favor signify by saying aye. 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 Motion carries.
Thank you.
Thank you. Item 6A, SUGS 2022 Amendment 2. And this has been approved by legal.
Move to approve.
Support.
Motion by Linda and support by Megan. And this is Dave.
Thank you. I have some information from Helen which will help clarify some of this. So the Substance Use Block Grant and State Opioid Response, which is the SOR or SOR 2, which is part of the detail in the board packet there. They're open several times per year to allow for any updates to the original work plans as occurs throughout the year. No major changes were required and the grant was signed. The second grant was also, that was released, contained the existing COVID grant projects that began October. The state requested additional information be entered in the work plan, such as number of services to be provided, and the updates were approved. This grant also includes the final approval of the New American Rescue Act, or ARPA projects. Funds will support initiatives that include evidence-based prevention services for alternatives to school suspension, increase access to services for disparate populations, creation of telehealth hubs, pro-social activities for youth and recovery center services for youth, as well as funds to support recovery housing. Because of the timing, the state did require that these be signed, so I did have some communication with the board. It was approved by legal, and then they were signed in the eGram system ahead of tonight's meeting, which is why they're listed as receive and file.
Thank you, Dave. Any questions for Dave? No questions, so we have a motion to receive and file. All support? Aye. All right. We received and filed. Item 6B, motion to receive and file for CSUGS 2022, Amendment 2. Is there a motion to receive and file? So moved and support? Okay. Dave? Same one? Okay. All in favor to receive and file the second report? Aye. All right. We receive and file both. Third receive and file, Crane's Leadership Program. This looks like some training. Motion to receive and file. So moved and support by Mark. Motion by Phil. Dave.
The details are in your packet. This was an interesting opportunity from Crane's in partnership with Wayne State University. We've been actively looking for trainings, resources to help our succession planning, building our internal resources. This one looked really good. So we discussed it at the executive leadership level, and then I put it out to a group of staff, 3 of whom were selected. They're very excited to start this process, and they'll be kind of our cohort. They'll be working together, supporting themselves through this, and then reporting back about what they're learning as they go through. The full agenda is listed there, and you can see it goes September through into November. Yeah, into November 17th. So like I said, it was an interesting opportunity. We were able to confirm them, and again, timing issue was if we confirmed by July 1st, there was a $500 per person savings. So we went ahead and pulled the trigger on that one.
Okay. Well, always like saving money. Thank you. All in favor of receiving and filing? All say aye. Aye. Thank you. Motion carries. I don't even know. Do we really need to have a motion to receive and file? But it's nice to do it. So. All right. Resolutions. We don't have any resolutions. It's just a nice thing to do. It's all nice. CEO update.
Well, given the way things are going tonight, I think I'll keep it short and sweet. We are working on a lot of internal projects, but we're going well. I met with our team member engagement group this morning along with Tracy. The board spending summary is nearing completion, just waiting to get some details plugged into that. We've also are currently working at the leadership level accomplishments since January of 2019, which is kind of when I officially started. So we're compiling that list. I put it out to leadership to get their feedback, make sure I covered all of our bases. But you as the board, and then it'll be available to our staff and everybody, is what's listed in that document along with the spending summary, which will show you how we've supported our providers throughout this pandemic, some of the new programs and initiatives that were approved and funded based on your approvals and oversight and guidance, which is greatly appreciated. And I think it'll be very nice to see it all in one kind of comprehensive report. So hopefully by no later the end of next week, I'll be able to share that with everybody.
Sounds great. Thank you, Dave. Just a reminder that our Recipient Rights Committee meeting is next Thursday, July 21st at 8 a.m. in our admin building. Also a reminder that our full board meeting is the 27th at 6 o'clock. Finally, hearing of the public. Is there anyone from the public looking to speak to this
Mr.
board?
Chair, can I chime in before we
Did
go
I
to the hearing
cancel
of the
something?
public?
Yes.
I just
Thank-
wanted to mention, earlier today in our committee meeting for the Board of Commissioners, we gave preliminary approval to a corp counsel attorney position specific to us for CMH. Yeah, that's what I kind of did sitting here. But John Shapka presented, you could almost feel the weight off of his shoulders, but tomorrow will be full approval, and it passed unanimously today, so I have to imagine that continues through tomorrow. So hopefully soon we will have our own designated corp counsel attorney. Thank you, Mr. Chair.
Thank you, Antoinette and Phil.
Back off of that, the fact that he said that this would be something that will continue to be in his budget. So that's great for our board and everyone that we represent, that we will have our own counsel from here on out, because this is in his budget, and the budget is approved, we will have it.
That's excellent news. Thank you. Linda, did you have something to say?
Yes, I just want to announce that tomorrow at 3:30, is it still on, Dave? Dave is doing an orientation for the Citizens Advisory Council, and I'm going to tune in. If you need the link, you can get it from Sandy, probably. What are you going to talk about, Dave?
I have no idea. All the acronyms, CCBhc,
The acronym.
CMH, SB, ASAP.
EZO.
They have new members, and he does do such a good orientation to new board members here that it was suggested that he also provide it for the CAC, and he agreed.
Thank you, Linda. Is there any other board member with any other comments or updates? No? All right, what about anyone from the public? Is there anyone from the public that wants to address the board? No? Okay, item number 10. Is there a motion to adjourn? So moved. Motion by Megan and support by Donna? By Antoinette? All approve? Aye. Aye. We are adjourned.